Moreover, a significant number of people are overtly allergic or otherwise immunologically reactive to chemicals in their environment. This phenomenon ranges from true allergies to something akin to non-allergic food sensitivities. It results in a range of idiosyncratic, highly individual immune reactions in susceptible people. As the old saying goes, anyone can become allergic to anything at any time. Chemical components of dental materials have allergenic potential. The development of IgG and IgM antibodies lead to type 2 and 3 hypersensitivity. The stimulation of recognition and memory in lymphocytes leads to type 4 delayed hypersensitivity. Haptenization of self-proteins leads to autoantibodies.
There is no question that patients can be allergic to dental materials used in their mouth, and even the American Dental Association recognizes this health complication. While allergic reactions have been reported to a wide range of dental products, including acrylic resin, resin composite, impression materials, and eugenol-containing products, the issue of allergies to dental metals is one specific area of growing concern. Researchers have even warned that dentists should be educated about this possible side effect. Quote, current data indicate that practicing dentists need to obtain further specialized knowledge about dental metal allergy in order to ensure the correct treatment of patients in their clinics. End quote. Source for this is from D. Kennedy and A. Just, Metal Allergies, Genetic Susceptibility to Mercury and Toxic Dental Materials Other Than Mercury. Champions Gate, Florida, IAOMT, 2014. The quote is from N. Hosaki et al. In the book chapter Dental Metal Allergy and Contact Dermatitis, edited by Young Suk Ro, Intech, December 12, 2011. Nickel allergies have received a great deal of attention due to their prevalence. Research has demonstrated that approximately 10% of women and 1 to 2% of men are allergic to this metal. However, a number of other dental metals are also known to cause problems for sensitive and allergic patients as well. The first case of report of dental metal allergies offered clinically was in 1928 due to the mercury in amalgam fillings. Since that time, in addition to mercury and nickel, allergies have been documented for dental metals such as titanium, gold, chromium, platinum, cobalt, tin, beryllium, and cadmium. Typically, reactions occur in the mouth, but they can also occur on the hands, feet, and other parts of the body. For citations to support this information, see this source, D. Kennedy, A. Just, Metal Allergies, Genetic Susceptibility to Mercury, and Toxic Dental Materials Other Than Mercury. Champions Gate, Florida, IAOMT, 2014. Researchers are currently delving deeper into understanding the complex factors that lead to the development of metal allergies. Genetics are obviously one variable being studied, and some researchers predict that specific genotypes will be correlated with adverse immune responses to metals. Additionally, there is an overall consensus that T cells in the immune system trigger the negative reactions. For citations to support this information, see this source, D. Kennedy A. Just, Metal Allergies, Genetic Susceptibility to Mercury, and Toxic Dental Materials Other Than Mercury, Champions Gate, Florida, IAOMT, 2014. Recent studies and reports tend to agree that metal allergies are on the rise. Part of this could be caused by increased exposure to metals, including ear and other body piercings, because exposure to metals has been cited as a potential trigger for the development of allergies to them. It has also been hypothesized that contact with metals during an infection could increase chances of developing a metal allergy later in life. At any extent, in a 2016 review, researchers from Harvard School of Medicine qualified, quote, dermal hypersensitivity to metal is common and can affect up to 15% of the population, end quote. Sources are D. Kennedy A. Just, Metal Allergies, Genetic Susceptibility to Mercury, and Toxic Dental Materials Other Than Mercury. Champions Gate, Florida, IAOMT, 2014. And M. Kaplan, Infections May Trigger Metal Allergies, in Nature, May 2nd, 2007. The quote is from Z.W. Teo et al., Hypersensitivity Reactions to Implanted Metal Devices, Facts and Fictions. However, One issue with calculating the number of patients with a negative reaction to a metallic material is that the onset of symptoms can be delayed and therefore might not be associated with the exposure. For example, research by Gerasi and Barova about amalgam allergies warns, quote, sensitization appears most frequently after the amalgam has been present in the mouth for more than 5 years, end quote. Source is D. Kennedy and A. Just, Metal Allergies, Genetic Susceptibility to Mercury and Toxic Dental Materials Other Than Mercury, Champions Gate, Florida, IAOMT 2014, and E. Gerasi and N. Barova, The Possibilities of Allergic Reactions from Silver Amalgam Restorations, International Dental Journal, 1969. It is vital for patients to remember that sensitization to metal can develop years after an implant or device has been placed, and that the adverse effects can occur with or without the sign of a rash or eruption on the skin or in the mouth. It is also important to remember that the wide range of symptoms patients allergic to metals can exhibit. The most commonly reported side effects from a dental metal allergy include pustulosis palmaris and a dyshydrotic eczema, usually in the form of erythema, blisters, and scaly and crusty skin, lichen planus, usually in the form of spots on the skin, glossidynia, usually in the form of pain or burning of the tongue, generalized eczema, and pseudoatopic dermatitis, usually in the form of an itching rash, and atopic dermatitis, which is chronic eczema with itching. For citations to support this information, see the source D. Kennedy A. Just, Metal Allergies, Genetic Susceptibility to Mercury and Toxic Dental Materials Other Than Mercury, Champions Gate, Florida, IAOMT 2014. Yet, many other health conditions have also been linked to dental metal allergies. These include oral lichenoid lesions, autoimmune dysfunction, myalgic encephalomyelitis and chronic fatigue syndrome, multiple chemical sensitivity, metallic pigmentation, orofacial granulomatosis, fibromyalgia, multiple sclerosis, infertility, and intraoral squamous cell carcinoma, a type of cancer. For citations to support this information, see the source D. Kennedy A. Just, Metal Allergies, Genetic Susceptibility to Mercury, and Toxic Dental Materials Other Than Mercury, Champions Gate, Florida, IAOMT 2014. An announcement in January 2020 by the Lupus Foundation of America provides another case in point. Citing a literature review, they stated, quote, people with lupus have a high risk of metal-delayed type hypersensitivity, including nickel, gold, and mercury, often present in dental materials, end quote. This is from the Lupus Foundation of America. People with lupus exhibit increased need for dental management, January 8, 2020. In addition to patients exhibiting allergic responses to dental metals placed in their mouths, research has also shown that dental personnel working with these metals are at risk for developing metal allergies. This includes dentists, dental technicians, and dental students. For citations to support this information, see the source D. Kennedy A. Just, Metal Allergies, Genetic Susceptibility to Mercury, and Toxic Dental Materials Other Than Mercury, Champions Gate, Florida, IAOMT 2014.